Hi, welcome to today's episode of Genes Matter, where we explore how genetic screening and early intervention are transforming breast cancer prevention. Breast cancer is now the most common cancers affecting women in India, with close to 200,000 new cases each year, and it's increasingly impacting younger women under 40. With advances in genetic testing, we can now identify breast cancer risk earlier than ever, offering a real chance to change outcomes and lives. Now, it's my absolute pleasure to welcome our remarkable guest today, Dr. Diksha Chadha, whose dedication and expertise in preventive medicine have set her apart as a leader in the field. With over 15 years of impactful experience, Dr. Chadha has covered an impressive range of establishing clinical research protocols to applying epidemiological techniques for disease prevention and providing strategic consulting across private, public, and governmental sectors in India. Now based in Singapore, she is a passionate advocate for preventive medicine with special interest in cancer prevention and women's health. Breast cancer has become the leading cause of cancer deaths for women in India. Yet it's rarely discussed openly, often staying within the women only conversations in the family. Given the vital role of women play in our families, breast cancer affects everyone, not just women. How can we encourage people to be more proactive and supportive in protecting the health of women in our lives?
You've very well put it together. It's one of the leading causes of concern nowadays when I'm speaking to women about preventive health. Also, this is something which is unique because most women throughout my career so far I've seen they tend to ignore their own health. But with the rising incidence, if you go to any room today full of women, talking to them about health and ask them to raise their hand if they know one person who has suffered from breast cancer, it's almost 100% of the room now. So the incidence is rising rapidly. Women are definitely concerned, but in our Indian cultural context, I feel women still tend to ignore their own health, and this is where the family really comes into picture. Whether it is kids taking care of their parents' health, so whether it is us in our age group thinking about our elders and encouraging them to start taking proactive action, preventive action towards their cancer screenings, or it is for our own partners. And in this, I really value it when men come to counseling sessions with their partners, because it really changes the way the woman also takes the subject seriously. So it's not universal, but in a very summed up way to say, I would say that especially in the cultural context of India, where we rely a lot on our family social support, that support goes beyond our day-to-day life and also to our healthcare approach and also to protecting the continuation of good health and taking a preventive approach for it.
So, in a way, breast cancer is unique that it allows for self-examinations that could allow you to detect the disease early. Yet, over 75% cases in India are discovered at a later stage. Is this simply an awareness issue, or are there any other factors at play? So my other question would be that can self-examination truly help detect all cases of breast cancers early?
If you talk about from evidence, we still don't have, unfortunately, statistical evidence which says that either clinical breast examination or self breast examination is an excellent tool to prevent mortality. That data is still not there. And if I begin to answer this question from my own experience of my mother, who is a breast cancer survivor, awareness definitely matters, and self breast examination matters. Anytime I used to introduce the subject of breast self examination, she used to be very reluctant about it, but at least there was a sense of awareness in her that breast self examination is something of value. And since she was practicing it in her particular case, we were able to catch her cancer early, thankfully, and get it treated promptly. So from not from statistical evidence, but from personal experience, not just of my mother's case, but countless others, I feel breast self-examination is of great value. No, it's not just an issue of awareness. Yes, that's also partly true. Somewhere in the awareness being also, incomplete. So while a lot of people are now aware that breast cancer is increasing in its incidence, a lot of people are still not aware about what to do with this information. So definitely that awareness is lacking at a mass level. Even when that awareness is there, even when the women are aware about lumps, one thing which we have unfortunately seen too many times now is there is a cultural context to it. Because this deals with such a private and intimate subject in a woman's life, sometimes she tends to take time in reporting it even to her closest family members, whether it is her partner, whether it is other women of the family. She may not be very comfortable immediately discussing the subject of breast openly in the family matters. And unless and until she does that, it will be very rare for a woman to directly go to her doctor to talk about it. So, in Indian context, I feel it is both partially a subject of awareness, but beyond that, also how the family approaches this subject and how open we become about talking about intimate areas of our life to our family members. That also is an important element of, how to further use this increased awareness to lead to action.
Now, the global guidelines say that women should start getting mammograms at the age of 40. But if you look at the data from India in the recent past, it shows that over 25% of breast cancer cases are happening in women under 40. And we even see a spike around mid 20s. Now, this makes us wonder, should we rethink the age to start screening? And also, like, what are the other different types of screenings that are available apart from mammograms and self-breast screening?
Anytime we raise the subject of screening, a person's mind immediately goes to mammography. But if we look at it from a different perspective, screening for breast cancer includes two things. One is screening for the risk of breast cancer, which is extremely important, and a completely different area in itself. And very few people are talking about it, unfortunately, about it. And the second aspect is screening for lumps. In that category, we can talk about physical examination, whether you do it yourself, self breast examination, or clinical breast examination, which is done by a trained nurse or a trained medical professional who can examine the person and screen for any physical lumps. Uh, the third way, and which we were talking about, is mammography, where we have set guidelines and patterns where we say begin to screen at age 40 onwards, when the tissue also supports detection of calcifications and other things. And there are other screening tools which support this form of screening for lumps, which includes MRI of the breast tissue and ultrasound of breast tissue. But if the question comes on when to begin screening, then the screening begins very early in life, as soon as you are born, even because you are born into a family where you are born with a certain genetic risk or predisposition to not just breast cancer but other risks also, because there is a certain overlap between breast cancer and certain other forms of cancer. So it's always a good idea to go for a universal genetic evaluation to see for cancer risk, not just say breast cancer. Yes. So screening for that can be as early as the person is ready for it. So there is no age cutoff for screening for the underlying risk. But the sooner you do it, the sooner you can start protecting yourself. So all of this can be done very easily with the help of somebody like SugarStrings. Other than that, there are certain modifiable risk factors, whether it is to do with your lifestyle, whether you are smoking, whether you are having a higher BMI, and then other risk factors include exposure to radiation early on in life. Now, coming to the subject of screening for lumps, then I would say the same age when breast awareness begins, which is, when we are taking sessions for puberty for both girls and boys. And at that point of time, we should take that moment to also introduce young girls and boys to the subject of breast health as well. And girls in particularly should be trained from a very early age to make it part of their monthly cyclical habit, to examine breast tissue and report to their mothers if they feel anything. We don't have to essentially talk to them about cancer per se, but we can at least make them aware about examining themselves.
Thank you, Dr. Diksha. And see, as Dr. Diksha mentioned, there are two aspects to the etiology of breast cancer. So one is the underlying genetic risk, and second is the lifestyle and the exposure to certain, cancer-causing agents such as ionizing radiations. Dr. Diksha, so it can be really overwhelming for common people to, choose between the right tests. We are talking about mammograms, we're talking about self breast examinations, we are talking about risk estimation using genetic tests, and there are complexities, etc. So, what will be your advice to common listeners? Like, how do they go about doing this in a simple sequential manner?
So, for an average person, both I'm talking men and women, it should begin with breast awareness. So that's sequentially the first thing. Knowing what your own breast tissue feels like is important if you want to know there is any change. Followed by monthly breast self examination. In case you note any difference in density, you will be able to take it to your clinical provider. Besides this, then we layer it up with clinical breast examination, which varies based on your age. So if you're less than 40 years of age, you can maybe do it once in 3 years. Or you can use an occasional visit to your gynecologist or any other doctor to also uh, ask for a clinical breast examination. Most medical professionals are trained for it. You don't have to especially schedule a visit for it also. But post the age of 40, you can do it annually, a clinical breast examination as well, on top of your monthly screens that you are doing yourself. Other than that, as per the guidelines, if you are more than 40 years of age, you can get a annual mammography or at least a mammography done once in 2 years. Now, this is for the average population where maybe you don't know your risk or your risk is less. But let's say you have the knowledge of your underlying risk factor, then the screening protocol is going to change a little.
All right. Now for tumor screening, I'm clear that if there is a tumor, then certain medical actions have to be taken. But when it comes to genetic risk estimation, if one know that they have a genetic risk for getting cancer, what kind of doctors they should go to, and when should they consult a doctor?
So you can start with a familiar face. This is what I would suggest. If it's a family physician, if it's a gynecologist that you have a good relationship with, if it's any other doctor, a urologist, or anybody in particular that you're familiar with or is your go-to person, start there. But if you become aware about your genetic risk profile, ideally, you should approach a preventive health specialist who will be able to further build upon this genetic risk along with your other factors, modifiable and unmodifiable, to create your overall risk profile for having cancer. Based on that, they will be able to create an action plan for you. Now, what does that mean? What that means is what action you can take to lower this risk. Because right now you are at a place where the disease does not exist. The fear of disease definitely is there, but the disease is physically not present. Also, everybody who has the risk factor need not end up having the disease. It's not a straight line. The whole advantage and point of knowing your risk early is to either delay the coming in of the disease or to prevent it altogether. How do you do that? To create an action plan. And what does that action plan typically include? It would include modifying the modifiable factors, and based on the unmodifiable factors, for example, in this case, genetic factors are unmodifiable, right? So a lot of people think, what will I do with it information? If I cannot modify it, what changes? Something very essential changes. As a physician, nobody is going to advise you to start getting mammography or other breast examinations done before the age of 40. The guidelines don't suggest it. But if you know your genetic risk for having breast cancer, then the guidelines will also encourage you to get mammography as early as 25 to 35 years of age. And because this is the period where you are also reproductively going to be active, mammography includes a certain risk of radiation. So, working with a trained health professional enables them to create an individualized plan for you based on your breast tissue density also. Higher the risk, overall risk that you have, you may even be advised to go for MRI instead of mammography. So what kind of screening tool to use also changes based on your knowledge of your risk. And concerning all the modifiable risk factors, as the name itself suggests, they are modifiable. So the moment you take action to modify them, your risk automatically goes down.
Yeah, so my next question is that how easy is to find a preventive health specialist in India? Because, what I found is that most of the preventive medical experts who we spoke to initially were all focusing on diabetes or endocrinology related conditions.
I think the landscape is evolving in India. So definitely we have a lot of preventive medicine specialists focusing on lifestyle interventions or on public health programs. But increasingly, you will see the numbers and the strengths of personnel trained in preventive medicine who are focusing on oncology or who are super specializing in areas like these. So increasingly, you'll see the number of doctors coming into picture and talking about subjects like these. One thing which is very interesting, which I have noticed, and not a very recent change also, is how many of my clinical colleagues now are also taking an interest to preventive approach. So you will see cardiologists or trained oncologists, surgical oncologists also have a very preventative approach to their field of science. The landscape definitely is evolving, and there are many of us talking about this. And I'm happy that you're looking.
So most people don't realize that men can also get breast cancer. Even though it's rare, it can make things dangerous because men may ignore the early symptoms, right? And it can lead to a later diagnosis. So, can you shed some light on what men should watch for and what they need to know about breast cancer?
The first thing they need to know is that it can happen, that men also get breast cancer. They also have breast tissue, and cancer can be found there. So, what men need to be aware about is two aspects of it. One, the symptoms don't or the signs of it do not change much. So, it's a very similar, presentation of cancer, which could be in the form of a lump or a rash or dimpling of skin or changes in nipple or discharge. So they need to watch out for those symptoms. The risk profile also is very similar. So if any woman in your family has had a history of breast cancer, ovarian cancer, any other form of cancer, and any close relative has had prostate cancer even, then your genetic risk for breast cancer also goes up. So men need to be aware of that, that if somebody, a mother or a grandmother also suffered from breast cancer, then men also need to evaluate their risk. That's one. Second thing is, in men, among the other modifiable risk factors, such as, obesity being a risk factor, smoking, alcohol consumption being a risk factor, liver disease also is one thing which predisposes men towards having gynecomastia and having breast cancer. So they should also be aware. Like I mentioned, it's for both men and women to be breast aware. You should know what your breast tissue feels like, so that if any time there is change, they should report that change. We cannot label breast cancer as a female centric disease. It cannot be all pink. So even when all of us who are responsible for creating awareness on the subject, when we are having conversations like these, it is important to keep it. Yes, of course, the focus is on women, but that doesn't mean that we don't include men in the conversation. Whether it is about raising awareness for family as a whole, whether it is taking the preventive approach and protecting the health of our own and our family members, or whether it is seeking treatment. It is another unfortunate thing that survival rate of male breast cancer is lower, which is because men tend to seek treatment for it later, assuming it cannot be breast cancer. So that's something which is dangerous. So if you detect a lump, any change, any other change suggestive of breast cancer as well, they need to report it to the doctor as soon as possible. The same advice we give to women, and we know evidence shows that women who show up early or who detect breast lump early, their survival rates are higher. So the same theory applies to men, and they should be aware that if they find something, they need to talk about it, should not feel ashamed about it.
Thank you, Dr. Diksha. And that brings us to the end of an enlightening discussion on breast cancer prevention through genetic screening and early intervention. Today, we have gained valuable insights into how genetic testing can offer a head start in the field of fight against cancer, giving individuals the knowledge and tools to make proactive health decisions. Remember, knowledge is power, especially when it comes to our health. Until next time, stay informed and proactive.